ADHD treatments will be easier to access from today after new rules allowing GPs and nurse practitioners to diagnose the condition. The law change might improve options for those wanting assessment for Attention Deficit Hyperactivity Disorder, but it won't be as cheap or quick as many might think. Earlier, I spoke with Sarah Hogan from ADHD New Zealand and asked her if this was good news for people needing access to treatment.
Well, overall, at ADHD New Zealand, we feel it's very good news. We're increasing the number of workforce that are able to provide this service to New Zealanders, and that will help in time to resolve some of the backlog that there has been around access to diagnosis and treatment. But we're not expecting that this is going to make a big difference for a while, because it could take some time for this to ramp up.
And so from now on, do all our GPs have the training to do these assessments? And then if not, does that increase the risk of misdiagnosis?
In fact, no, they don't have the training to do this. And we know from our ADHD community that a lot of people's experiences with their GPs has not been very positive. Lots of people report that their GP doesn't have great knowledge of ADHD or hasn't been very sensitive to them when they've been referred back to the GP after seeing a specialist. But we also know that GPs are being offered training modules now to ramp up their skills and their understanding of ADHD so that they can support people and provide these assessments.
Do GPs even have the capacity to be adding this kind of work to their workload already?
Well, that's a really good question. We know that GPs are under a lot of pressure, and it really will come down to the individual GP or the individual GP practice to decide how they can accommodate this. So one thing is that because of the prescribing rights being extended to GPs, they don't necessarily have to be doing diagnoses. They can just provide better support to patients around changes to their existing prescriptions. So it might be changing medication or changing dosage, and just being able to do that, which takes less time than an assessment, would be an improvement in itself. They may also choose to do ADHD assessments, diagnoses, but that will normally take about an hour and a half of time at least. And so currently for GPs, that's a lot. So to respond to that, what we might see is that some GPs end up in arrangements with psychologists in their local community, where the psychologist undertakes the assessment, provides the report to the GP, and then the GP does the prescribing. And that's all possible under this current arrangement, because the diagnosis and the prescribing rights are actually separable.
Another big part of this, of course, is how much it all costs. Can people wanting diagnosis or medication expect it now to be far cheaper, seeing as they don't have to see that psychiatrist if they're just going to a GP?
So we don't know exactly how much it will cost, but we know it's not a funded service. The Ministry of Health hasn't put any new funding into diagnosis of ADHD. In fact, there is no funding for diagnosis of ADHD, except in the case of a small number of children who are able to access that through the public system. For adults, there is no funding. And that means that it will still cost. It will cost quite a lot. So currently we know that people are paying somewhere between $1,500 and $2,500 for diagnosis by a psychiatrist. It should cost substantially less than that to have it done through a GP or through a GP psychologist partnership. So we might be looking at up to $1,000, but it's still not what we would consider to be affordable for most New Zealanders.